Welcome back to the Pelvic Health Summit. I'm here with Dr. Charity Hill, who is a medical doctor and physiatrist who treats patients at Pelvic Rehabilitation Medicine in New York and New Jersey. Welcome.
Thank you.
So can you tell me a little bit about what inspired you to get into this field?
Yeah, absolutely. So I always knew I wanted to be a doctor from a young age, and I was a really active athlete. I played 4 sports going through high school, played 2 sports in college. Around 16, I started having really severe back pain and lower abdominal pain, and I just figured it was because I was so active. The doctors didn't really seem that worried about it, even if I was kind of in crippling pain during my periods. They were just like, oh, that can happen. It'll get better when you have a baby. Fast forward about 5 years when I was in medical school, and I was with one of my lead physicians. We had a patient with pelvic pain, and he's like, oh, these people are all crazy. Like, they got something wrong with their heads. And I just kind of looked in myself, and I was like, am I crazy? Like, am I making this up? I think I have better things to do with my time than invent this pain. And from then on, I just kind of investigated and tried to find doctors who believed in it. I specialized in sports and spine, but then kind of tried to apply that knowledge to the pelvis and to treating the muscles, nerves, and bones and joints of the pelvis. And meanwhile, eventually finally found a doctor who could diagnose me with endometriosis. And so, I mean, I figure if it was a 20-year journey for me to get diagnosed as a physician, how much harder it would be for the layperson to actually get an accurate diagnosis and get timely treatment.
Yes, well, thank you so much for sharing your story. I know a lot of us can relate. So can you tell us a little bit about what patients can expect when they come and see you in your practice?
Absolutely. So we try to be the opposite of what most people have expected, where they get blown off or called drug seekers or called or told their pains in their head. We try to be a really warm, welcoming environment. Take a good hour to an hour and a half to listen to your story, because by the time people have seen us, they may have seen 10 or more providers, and there's a lot of story there to be told. And so we want to make sure that we are welcoming and will hear your entire story and treat you respectfully.
That's fabulous, so important. So when someone comes in and they're presenting with some symptoms that may be endometriosis, can you tell us a little bit about what that diagnostic protocol is and what other practitioners you kind of relay that patient to?
So with endometriosis, if people have symptoms that we suspect, like very painful periods, heavy bleeding or clotting with your periods, pain with sex, low back pain, or maybe even pain radiating into the hips or the pelvis with your period or with ovulation. Up until recently, the only way we could diagnose that was with surgery, and so we'd have to send people for a diagnostic surgery where they would also treat it. Right now we're part of kind of a groundbreaking study where we can take a sample of menstrual blood and send it for analysis, and that's actually very accurately diagnosing whether or not people have endometriosis. And I think that's going to change this whole field, because people like me at 16, instead of a doctor having to send someone for surgery, they can just take a really quick sample and give an accurate diagnosis, which I think will just absolutely revolutionize this field and get people treatment much, much quicker.
Definitely. Can you tell us a little bit more about the study?
Sure. So it's called the ROSE study, and all the physicians at Pelvic Rehabilitation Medicine are co-authors on this study. We're really looking to reach out and expand the knowledge of endometriosis and really expand access to early and accurate diagnosis.
Wow, that's amazing. So we are going to link to that study and some more resources around the ROSE study, so stay tuned. So can you tell us a little bit more about people who do have endometriosis who come see you who have painful symptoms? What are some of the ways that you can help lessen those symptoms?
So we look at endometriosis. Endometriosis doesn't just affect the reproductive organs. It can affect the bladder, it can affect the bowels, it can affect the nerves and muscles and joints of the pelvis. And so we like to be what we call the quarterback of the patients who come to see us, and essentially make sure they're getting the best as far as urological care, gastroenterology care, seeing a great surgeon who will do a proper excision. And also, from our part, we try to take care of the nerves and muscles and joints, and we can use things like trigger point injections, nerve blocks or nerve dissections, or joint injections as needed, to make sure that pain is well managed, kind of from an all-around standpoint.
Wow, super exciting. What other innovative methods have you been working with and that are coming down the pipeline?
So we're doing a trial right now where we are using an external stimulator on the posterior tibial nerve, just using a simple TENS unit, which a lot of people have at home. The posterior tibial nerve is right behind the ankle, and it's connected to the nerves that also innervate the bladder. So it's very common to have bladder feeling like urgency to go to the bathroom often with people with endometriosis. And so we're using a stimulator on this nerve to try to decrease that symptom and really getting awesome results for a really low cost and simple intervention that can be done at home.
Wow. Can you tell us a little bit more where we can find information about this?
So you can definitely find information on our website, which is pelvicrehabilitation.com. We have a lot of information about painful bladder, and I have a video on YouTube about painful bladder as well, which kind of goes into more detail on that.
Fabulous. We'll link that for sure. So can you tell us a little bit more about myths that are associated with endometriosis? I know you touched on, that people might think that it's in your head, but I know there's so many more myths, so please enlighten us.
So one of the myths of endometriosis is that it makes you infertile, and so I actually have some people who have all the symptoms of endometriosis, severe pain with cramps, severe pain with sex, but they were able to have a child at some point. And so they believe because of that they don't have endometriosis and actually delay receiving care. And so that's definitely one of the myths of endometriosis, that it always universally causes infertility. And another myth is that it is always painful, which in some people actually isn't painful. It's definitely more rare, but they may have kind of severe bleeding or clotting or things like that, and so we do see the rare person where they actually have endometriosis without much pain associated.
So you touched on some people with endometriosis who were able to have a child. Can you talk a little bit more about those with endometriosis who are going through infertility and hoping to have a child?
Absolutely. And so some people actually don't get diagnosis of endometriosis until they're going through infertility and maybe seen in an infertility clinic and get the diagnosis of unexplained infertility. But during a surgery or procedure to diagnose the cause of infertility, they may find endometriosis. The one thing I would say, a lot of people don't want to get treatment for their pain because they think it may delay getting treatment for their infertility. But if you are in severe pain and not able to have sex, that's obviously going to make it harder to have a child. And also, pain increases stress, which we know also is an added aspect of infertility. So when I have someone who's kind of going through both things at once, I'm like, look, we really have to prioritize a few months to get rid of this pain, so you'll be in a better state to get the rest of your infertility process going. Unfortunately, it is very common to have issues with infertility, so I'll usually be pretty proactive in working side by side with a fertility doctor to get all the testing done, because the priority is to, have a healthy child and a healthy pregnancy, and so we often work side by side with fertility doctors to achieve that.
Awesome. And can you share some success stories, both with having a child while you have endometriosis and also just endometriosis pain management?
Absolutely. And so I really love that I myself have finally gotten to the other side of this. And so I'm able to share my story with patients and be a little ray of hope for them, because when I just assumed I'd have pain for the rest of my life and that's what my life would look like. And you can kind of settle into that and think you're okay with it, but no one's really okay with being in pain for the rest of their life. And so being able to share my story with patients as I'm in the room and be like, look, there's another way you can live. There's really light at the end of the tunnel, and there's treatments we can offer for you. There's no cure for endometriosis, but we can definitely treat the symptoms of endometriosis, which are limiting your life.
Thank you so much. Can you tell our viewers a little bit more about where they can find you?
Absolutely. So we're at Pelvic Rehabilitation Medicine, and we're located in Hoboken and Midtown Manhattan, and you can find us at pelvicrehabilitation.com.
Awesome. Thank you so much.
Thank you.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.